Hi, welcome to the University at Buffalo School of Nursing information session where we're going to overview our Bachelor's in Science in Nursing, both our traditional and our accelerated track. I want to introduce myself. My name is Julie Kim-Proehl. I'm the Assistant Director for Undergraduate Admissions here at the UB School of Nursing. Here is my email address, which is my preferred method of communication, but also my direct phone number. If you have any questions after the presentation, please feel free to contact me. Now, many students who are interested in our traditional accelerated really have questions regarding the prerequisite courses. I highly recommend that students submit a transcript evaluation. Now, this is a service I provide where I can help you identify courses that you've completed, make a suggested course plan, either at UB or at your local community college or a school of your choosing, and provide you with the exact equivalent course numbers and give you a recommended timeline. I highly recommend students to submit a transcript evaluation. It typically takes about 1 to 4 weeks to complete. And once completed, we can actually schedule a virtual or in-person meeting where we can review the transcript evaluation together and also answer any individual questions. Here is the online form, and in this online form to request a transcript evaluation, all you would need to do is complete the questions in the questionnaire and then upload unofficial copies of your transcripts. If you are a former UB student, you just need to answer the questions as we already have access to your UB courses and your transfer credit already posted in Hub. So again, I highly recommend that students who have questions about prerequisites submit a transcript evaluation. Now, to overview our program, I really want to highlight the things that set the UB School of Nursing apart from other schools. And these things I'll be highlighting will be location, clinical experiences, our NCLEX pass rate, our caliber of our program, and the affordability. Now, one important thing is when you're looking at nursing schools, where a school is located is going to be very important in your search process. And that is because you train to become a nurse by not only the faculty, the curriculum, but by rotating through clinical sites in that area. And here in Buffalo, we have a wealth of clinical opportunities that you're not just going to find in any other city. Buffalo is the second largest city in New York State. We have a wealth of clinical opportunities like ECMC, Erie County Medical Center, which is a Trauma 1 level hospital. We also have Roswell Park, which is a nationally designated cancer institute. People travel from all over the country to get treated here at Roswell Park. And then we also have the Kaleidos Health System and the Catholic Health System, in addition to other types of clinical locations like Buffalo Hospice, the VA, which is located right behind the School of Nursing. So as far as our clinical experiences, we have opportunities for dedicated educational units, which are smaller ratioed clinical settings. We have students who will complete over 600 clinical hours, and then we will have an opportunity to go to many of those sites that I listed in the previous slide. We also have a one-on-one preceptorship that students do prior to graduation, and we're utilizing a high-fidelity simulation lab as well as virtual reality simulation as part of your experience here at the UB School of Nursing. Another thing that sets the UB School of Nursing apart is our NCLEX board pass rates. We're really proud of our students, our faculty, and our curriculum by making sure that when we admit a student into our program, that not only do they graduate, but that they pass their boards. In the last year, we had a 100% pass rate from our traditional and our accelerated class. And this is on the first attempt on the NCLEX exam. And things we do to ensure an excellent pass rate is by utilizing NCLEX software from day one. We really want you to think like a nurse and also learn to take an exam like a nurse. So we utilize a NCLEX software called ATI. So as you're learning concepts in health assessment, you're taking mini NCLEX in those concepts that are the most vetted questions that you'll see similar to the NCLEX exam. We also utilize CoursePoint, that which has a question bank, as well as ExamSoft, as well as all of your exams at the School of Nursing are going to be administered in NCLEX style. Another important thing that sets the UB School of Nursing apart is the caliber of our program. We've been consistently ranked among the top 10% of nursing schools across the country and one of the highest ranked nursing programs within both the SUNY and CUNY system. UB is a New York State flagship university, and we are also a Research One institution. So we really focus on making sure we intertwine evidence-based practice into your curriculum. So we really want to be teaching you what the current research shows provides the best outcome for your patients. Next is really our faculty. Our faculty are some of the best in the country, and many of our faculty here at the UB School of Nursing are going to be doctorally prepared with their DNP or their PhD in nursing. Now, last thing, UB is a SUNY institution, and you will find the affordability of our tuition. For our ABS program, when you think about that 4 semesters, for in-state tuition is about $24,000 for New York State residents. And for our traditional program, for 1 year of coursework, a fall, spring semester, you're estimating about $12,000, and that includes tuition and fees. Now, these costs don't include room and board, your laptop, your uniform, your NCLEX software, supplies, travel to clinicals, and health insurance. Another important thing is that we want to support our students with scholarships. We have upper division nursing scholarship application that combines many of our alumni donations and endowments that are available to our students in our upper division. UB Honors College also provides scholarships. We encourage students to apply to the UB Honors College. And then, of course, there are external scholarships that our students additionally apply to. And then this is just some information about the Bureau of Labor Statistics average salaries of a registered nurse. Now, to go over our program in detail, first we'll overview our Accelerated Bachelor's in Science in Nursing. Now, the Bachelor's in Science in Nursing is for people who have a bachelor's degree completed already. Now, this can mean that you are graduating from college. We do have a group of students every year that literally walk across stage on Friday and start our program the following Monday. But we also have students who are doing career changes, who maybe graduated last year or 5 years ago or 10 years ago, who have a bachelor's degree in a field outside of nursing. And this program is specifically designed with career changers in mind. And people are really coming from a wide variety of educational backgrounds. And that's the great thing about our accelerated program, is that you're really bringing your expertise from your previous education and work experience into the field of nursing. So how the program is designed is an accelerated 12-month program. So accelerated means that we are condensing the curriculum that's typically done in 2 years into 1 year. And that's done by doing 2 6.5-week summer sessions back to back. And so you really want to be prepared that you're going to be quite busy in this program. And we typically tell students, typically in the summer, you want to expect to physically be in class, lab, or clinicals 4 to 5 long days out of the week. Now, the program itself starts in the summer and typically starts in mid-May. And as I said earlier, the program is designed with career changers in mind. So even though there's 9 total prerequisites, only 4 have to be completed before the October 1st application deadline. The remaining can be completed prior to the program starting. So in the term that you're applying or the spring semester before the program begins. The application is competitive, so it's really important to make sure that you submit a strong application. Now, the program timeline. Now, as I said, only 4 prerequisites need to be completed before the application deadline. So that means that hypothetically, if you have one or two courses previously done in your bachelor's degree, you may only need to do a few more prior to the application deadline. The remaining courses then can be completed in the fall, spring semester prior to the program starting. Now, in order to apply, by the application deadline of October 1st, you would need to have 4 prerequisites completed, and then also the 3.0 cumulative GPA met and the 3.0 prerequisite GPA met. The nursing CAS application opens in early August and again has an October 1st priority deadline and a November 1st final deadline. The remaining courses just need to be completed in the fall and spring prior to the program starting. In addition, we also require that your bachelor's degree requirements be completed prior to the program start. The program length is 1 year, so that goes 12 months. So it's a May to May program with 2 summer sessions that we do back to back, a fall semester and a spring semester. We have 64 students that we admit every year to this program, and the average admitted GPA is around a 3.6. Now, our traditional program. Our traditional program would be for potential high school students, UB students, transfer students, and sometimes students who have a bachelor's degree already. The program to the upper division is a fall start only, so we only admit a cohort into the upper division in the fall term. Now, our traditional program is described as a lower division and then upper division. The lower division is typically the first 2 years and entails a sequence of prerequisite courses. The upper division is the final 2 years, and that includes your nursing courses and clinicals. Students typically apply to the upper division in the winter break of their sophomore year. Admission is competitive, so we do have more qualified applicants than there are seats in the program. So it is really important to make sure you put together a strong application when you apply. Now, one important thing I wanted to mention is that we do offer one guarantee for high school students. Now, if you are a high school student and you have a strong profile, I highly recommend you to apply to the UB Honors College. The UB Honors College, we offer a guaranteed dual admission, where students will complete the prerequisites, submit the application. However, if they remain in good standing with the Honors College, we will guarantee them admission to the upper division. Now, good standing still does require a UB GPA of a 3.5, but that does mean that it's a little bit lower than our average admitted for our traditional program. So I highly recommend strong high school students to apply to the UB Honors College, and you'll see the benefits of the guaranteed dual admission. So for high school students, you can apply to as a high school senior, you would apply to UB as an intended nursing major. And in addition, we recommend you apply to the UB Honors College. There is a bump out in the Common App, or if you apply to UB with the SUNY app, you can contact the Honors College separately for their application. The first 2 years are a series of prerequisite courses. And again, in the winter break of your sophomore year is when you typically apply and submit the nursing CAS application. And that is the application to the upper division. That application opens on December 1st and has a January 15th deadline. Now, if admitted to the upper division, your last 2 years are your nursing courses and clinical courses. We only start a cohort in the fall semester, and we start 80 students. Now, again, it is competitive, and so if you look at some of our average profiles in previous years, the average admitted GPA falls around a 3.65. So what are we looking for when you apply to the upper division? What I always like to say is we want to see a total package. To be a good nurse, you really want to have strong academics, but you also want to be a well-rounded candidate. So when we do a review, these are the factors that we look at. We really want to be as transparent with you about what are the components that are in the review. So the first most important component is your grades. Your grades are more than half of the review. Now we'll be looking at 3 grades. The first grade being your prerequisite GPA at the time of application. So specifically your grades in the prerequisite courses. And if you think about the minimum for consideration, that is a 3.0, which is a B average. But the average admitted student is getting around a 3.6 or 3.65. So that means on average, students who are getting admitted into the program are getting A minuses in these courses. Next, we'll be also looking at your CUME undergrad GPA. So this includes every single college level course you've taken. So that is at the undergraduate level. And that includes college level courses while you've taken in high school, courses you've taken in your undergraduate degree, and undergraduate courses you've taken after graduation. Next, and we'll be also factoring in your science prereq GPA. So specifically in your grades in anatomy, chemistry, microbiology, those will be weighed a little bit more in the review process. Now, to be a great nurse, doesn't mean you just have to have a 4.0 GPA. You really want to have some of those additional soft skills. So we're really looking at your essay, a series of essay questions. We require 2 essay questions to submit the application, one that requires a specific video prompt, and we'll ask you to make a response to that and record it and upload the video of that response. Next is a specific written response, and that will be submitted using 2,000 characters. And so that really is about 2 short paragraphs, as it does include spaces and punctuations. Then lastly, we will also be looking at a resume. So we really want to know, what are your work experiences? What are your volunteer experiences? Have you been involved in the community? Do you have any leadership roles? Have you had research experience or teaching experience? Really, this is the opportunity to highlight and really brag about your accomplishments. So oftentimes people ask about the average profile. So this is the average profile, I believe, from 2023 for our ABS program. The average admitted GPA was a 3.55, with that middle 50% range running around this range. And the average undergrad GPA being a 3.43 with this middle 50% range. We typically have about 140 applicants every year for 65 seats, and this is the general admission rate. Now, our traditional program, the average admitted GPA is around a 3.65, and for prerequisite, and the 3.7 for undergrad. And we typically, again, have around 140 applicants for 80 seats and about a 40 to 60% admission rate. Now, the prerequisite courses. Now, there's 9 prerequisites for our Accelerated program and 11 for our traditional. Now, important, when you do the prerequisite courses, we only accept a grade of C or higher in each course. We will not accept C minus or lower. And also, if anybody does an A&P 1 and 2 sequence, please note they also have to be completed at the same school. And lastly, we won't accept any pass grades. We do require a letter grade for the prerequisite courses. Now, chemistry, we require a college level chemistry class with or without a lab component. We typically accept a health science chemistry or a Gen Chem 1. We will also accept higher level chemistries. Let's say if you have Chem 2 or Ogre 1 or 2, if you have a higher grade, we will use that as the higher grade. But for our prerequisites, we only require 1 chemistry course. Next, we have a human anatomy course that has a lab component. And then at UB, we have a human physiology course. Now, some students may do an A&P 1 and 2 at another school. Please note that typically A&P 1 and 2 combined fulfills our human anatomy class and our human physiology class. So A&P 1 typically counts as 1 course, and A&P 2 counts as another course. Please note that it also does not fulfill applied physiology. Applied physiology is a separate course from A&P 2. It focuses on the body's response to disease, and it builds off of human physiology and A&P 2. Next, we have a microbiology course with a lab component, and lastly, pharmacology. Now, if you're looking to take these courses at other schools, please know sometimes you might not always be able to find applied physiology and pharmacology at every school. UB does teach both those courses in the fall and spring, but also if students need any assistance finding alternate options, please feel free to email me. Next, we have a human growth and development course, which covers the lifespan, a nutrition course, and a statistics course. Those are the 9 prerequisites for the ABS program. Now, in addition, the traditional program also includes an intro to psychology and an intro to sociology course. Now, another important thing about the prerequisite courses, especially the science courses, that they are sequential in natures. So it typically takes about 3 semesters to complete the prerequisite at most schools. And this is the sequencing that is required at UB. It may vary if you're taking courses at other schools. So at UB, you will typically have to take chemistry or anatomy before you take physio, and then physio before you take applied and farm. Another important thing is that the time it takes to do well in these courses. Many times we recommend that as students are planning their prerequisites, they take 1 to 2 science courses every single semester. And an important thing is that understanding that many of these science courses do take quite a bit of time if you want to get a good grade. We typically recommend students study for, let's say, if you take anatomy as a new student at UB, we typically recommend students to be studying 8 to 12 hours for just anatomy every single week for that course. Another important thing is that students ask typically about, how do I know if I've met the prerequisites? Or how do I plan the rest of those prerequisites? We have a couple resources for students to utilize. The first and most important is Taurus. Taurus is a database where students can look up courses and see how they transfer to UB. And so I do want to demonstrate how to use this website. So Taurus, as I said, is a database that shows how courses transfer to UB. So when you go to the Taurus website, I highly recommend searching by equivalencies by school, not by course, but by school. So if you search for equivalencies by school, you can type up the school name. And so I'll just type in our local community college here. I'll press search. And then it'll pull up on the courses on the left would be courses and how the course numbers at Erie Community College, and the courses on the right would be exactly how they transfer to UB. So I can show you here at ECC, you'll see this is their anatomy and physiology 1 lecture and lab, 2 lecture and lab, and that you'll see that it'll transfer to UB as our anatomy and our physiology course. So you can use this website to look up the equivalent chemistry course, which is, we accept this chemistry course, or this chemistry course fulfilling our chemistry requirement. Another important thing is if you don't see your course or your school listed in Taurus, it doesn't mean that we don't accept it. What it means is that we will need to evaluate the course to see if it is equivalent. And you can do that by going to Taurus and going under the articulation request process. Right here. And under the articulation request process, you will go under the guest system and you will read the directions and then just click on login. And then what you would want to do if you don't see your course listed in Taurus, you can obtain a syllabus by contacting the school, typically the department that taught your course, and ask for a previous syllabus. And then once you obtain the syllabus, you would go to this website, enter the details of the course, attach the syllabus, and send it to the department that teaches that course. So you can typically send it to the nursing department, which is NSG, or if it needs to be reviewed in the chemistry department, it would be CHE, or if it's in the microbiology department, it would be MIC, or if it's in the nutrition department, it would be NTR. And so you can submit this and attach the syllabus and submit it. And then it will get reviewed with the faculty that teach that course in that department. And as soon as they make a decision, you will receive notification. If anybody has any questions about submitting syllabuses or need assistance submitting, they're welcome to email me. Also, the TOR system only allows for 3 submissions from non-UB students. So if you've already hit that 3 submission max, you can email the syllabus to me and I will submit it on your behalf. Next, we also want to highlight again our transcript evaluation request process. I highly recommend you do that. After that transcript evaluation is received and the evaluation is emailed to you, you have an opportunity to meet individually with myself, virtually or in person. Also, for UB students, whether a new freshman or a transfer student, you do receive advising directly from our staff to make sure that you are well prepared to apply and you have all the prerequisites completed or you're registered accordingly in those courses. Now, when you apply to the program, we have the application materials. These are the required components. We have a 2-minute max video prompt and a 2,000 character written report and an itemized resume that you will submit as part of the nursing CAS application. Just general tips when you submit the application, make sure your essay and video responses are clear and to the point, that you're demonstrating professionalism in your tone and appearance, and then you also show that you have strong communication skills. Lastly, you want to make sure you follow the directions and that you really highlight your well-rounded experiences. When you apply, we require a 3.0 prerequisite, 3.0 cum GPA. For the ABS program, only 4 prerequisites are required to be completed by the October 1st deadline, and the remaining courses prior to the program starting in the summer. Your bachelor's degree as well has to be completed prior to the program starting. For our traditional program, all 11 prerequisites have to be completed or in progress. So you do have to be registered in all those prerequisite courses in that spring semester after the application deadline. So when students apply, any high school students, you are not currently ready for your nursing CAS application, so just apply as an intended nursing student and additionally to the Honors College. But if you're ready to apply to the upper division, that is when you will submit the nursing CAS application. There includes a $60 fee. For any non-UB students applying, you would also need to submit a UB transfer application, and there is a $50 fee for that. Former UB students do not need to submit the transfer application. Instead, they need to submit the UB re-entry application. So I do want to demonstrate what those applications look like. So this is the nursing CAS application. This is a centralized application for nursing schools that lets you apply to more than one school. You will create a login and password, and once you create a login and password, you'll select the correct term. For ABS, that would be summer, and for traditional, that would be fall. And once you do that, you'll go to the Add the Program section, and you'll type in Buffalo. And when the application is open, so in early August, the option will be available for our ABS applicants. And on December 1st, the option will be available for our traditional applicants. You'll be able to add the program. And once you add the program, you'll see these 4 tiles. The first tile is your personal information tile. And this is really very straightforward, your biographical information. Next would be on the academic history tile. We do not utilize the transcript features in nursing CAS. So you do not, if you only have our program selected, you do not need to do this transcript feature. It'll say that it's not required for the program you had selected. We also don't ask that you send transcripts to nursing CAS, but instead send them to UB. If you are a current UB student or former UB student, you do not need to send UB transcripts. as well as you do not need to send any transfer courses posted to your hub student center when you are a student at UB. Next, we have no entrance exams that are part of our application. So we do not require a TEAS test or a GRE. And then lastly, you want to make sure you list every single college attended and you provide those transcripts. Even if you only attended for one course while you're in high school, we still ask that you list that school and provide the transcripts. Now, the next part of the review is going to be your supporting information section, and it's going to be that resume. So the resume is not a document you upload. You actually have to enter in each individual work experience, volunteer experience. So you want to go to the supporting information tile. You want to enter in any of these categories, and you want to enter in your work experience, your volunteer experience, any healthcare experience. Also, really, this is an opportunity to really brag about yourself. Tell us what you've done outside of the classroom or in the classroom that really highlights unique experiences that you've had. So have you done research with faculty? Have you been a leader on campus? Have you been a leader in your place of employment? Have you been involved in your community? Really, again, this is an opportunity to really brag about yourself and give us a better picture of you as an applicant. Next, you're going to see the essay questions. So the video question and the written question are going to be listed under the program material. And you would go to the questions tab, and then you would scroll down and you would see the questions. You'll have the video question, which is a 2-minute max video response, and the written question, which is a 2,000 character response. I highly recommend students to log into NursingCast when the application opens, copy and paste the questions, and start working on preparing them ahead of time. You want to take your time to make sure that you prepare thoughtful responses to those 2 questions. And once you're ready, you can enter them in the field and submit the application. The NursingCast application is something that you can start and pause and work on at a later date. So you are able to save your responses and come back to it before you submit the application. Once you're ready to submit the application, there is a $60 application fee for the first attempt. NursingCast does have fee waivers, though they do recommend that you submit any requests for fee waivers 2 weeks ahead of time. They have an income guideline or different categories of what are your eligibility for fee waivers. Now, the NursingCast application is very important and it must be submitted by the application deadline. We do not accept any late applications for your NursingCast application. And your NursingCast application is what will review you for the program. Now, in addition to your NursingCast application, if you are not a student at UB, you will also need to submit the SUNY application. And the SUNY application is a quick application you can do probably in a few minutes. You'll create a login and password. And then once you create a login and password, you'll get started and you'll select your campus. Make sure that when you select your campus, that you select the correct term. So the Accelerated program is the summer term selection. For the traditional program would be the fall term, unless you're planning to do prerequisites at another term. So let's say you apply for the accelerated program. When you select your campus, you want to make sure you're selecting the correct campus. And that is going to be Buffalo, University at. And you would see for summer, you'll only see the Nursing Accelerated program listed as we're the only major that admits during the summer here at UB. If you're applying for our traditional program, you would select the fall, and then the major you would select would be the nursing major, the bachelor's on campus. Please do not set RN to BS. This is for if you're already a registered nurse. So please make sure you select nursing bachelor's on campus. Now, the SUNY application does have the $50 fee as well to submit. There are fee waivers for this, and there's different income guidelines that can qualify for fee waiver. And again, if we ask that if you're requesting any fee waivers, that you submit them 2 weeks before the application deadline. Now, if you are a former UB student, you do not need to submit the SUNY application. You just need to submit the nursing CAS application and the reentry application. The reentry application looks like this. It is a quick online form. There's no fee for the reentry application, and then you would just select your term and your major. For ABS, again, that would be the term of summer and the major of accelerated BS in nursing. For the traditional program, if you're applying for when the program starts, that would be for fall, and the major would be nursing. All right, tips for submitting a strong application. We highly recommend make sure you follow the directions carefully. You are also entering a professional career, so we really want you to be able to demonstrate professionalism. Also, another important strong attribute in nursing profession is strong communication. So you really want to be able to show that in your video and written responses. We also recommend students to reflect on their experiences. And also, I think it's important to make sure that you explore the field and the profession of nursing. And whether that is volunteering in a healthcare setting or working in a clinical role or shadowing a nurse. And I think it's really important to make sure that you can demonstrate that you've researched the field and that is a good fit for you. Another important thing academically is making sure that you want to have good time management and study skills. And this is an important thing to prepare as you're taking the prerequisites. You want to set high expectations for yourself and try to get A's in many courses as possible. And also know that universities and colleges have assistance for students. So if you need help, make sure that you're asking for it, whether from your professors, your TAs, or tutoring on campus. Lastly, if you are interested in actually visiting the UB School of Nursing, I typically host in-person tours of our simulation lab and information sessions once every semester. So typically once in the fall, winter, spring, and summer. I encourage you to visit our website to check for those dates and RSVP. I also offer virtual information sessions where you also have an opportunity to speak with me. And again, you can check and RSVP for those dates on our website. Next, students are also sometimes interested in visiting UB. So I highly encourage students, especially high school students, to visit the UB Office of Admissions visit opportunities. They have North Campus tours, South Campus tours, and larger campus-wide open house events. And I recommend you visit the UB Admissions Office visit page. Well, lastly, thank you for joining me and watching this presentation. I want to just say that we look forward to seeing your application. If you have any questions in the future, please feel free to send me an email or give me a call. Well, thank you again and have a great rest of your day.